Glad to be here. Hello, everybody. So low vision is a vision impairment that cannot be corrected by your standard glasses, contacts, surgeries, or medications. So they cannot be corrected back to normal vision. And the most common conditions, that cause low vision are age related, and they include macular degeneration, glaucoma, diabetic retinopathy, and cataract. And that comes from the CDC. That's the most common diagnoses here in the US. And then although there's treatment for cataracts, some people don't have access to that treatment, and so they do then experience low vision. So maybe their insurance or cost or just their lack of awareness that there is a treatment. So that's why cataract is on the list, even though there is a treatment out there for it. But that macular degeneration is the condition that I see most commonly. But yes, something that can't be corrected with, you typically are used to experiencing the eye doctor, glasses, contact surgery, or medication. Most folks have, a general optometrist or ophthalmologist that they see on a regular basis, maybe yearly, maybe sooner than that, depending on the condition. And, that person should hopefully refer them to low vision services if they see that need or they hear, the frustrations that their client or patient is having. Now that doesn't always happen. The general or your retina specialist, he or she may be really focused on treating your condition and making sure the health of your eye, everything that they can do is being done. And sometimes they don't have time, or they may just not be aware of the services that are available. So the hope is that they would refer, but it doesn't always happen that way. And so it's also important to advocate for yourself. If you are having frustrations due to low vision, or someone that is, it can be helpful to seek out that low vision specialist, whether it's an optometrist, occupational therapist, or other state provided services. You can always contact them, and most of them will then contact your eye care professional, just to make sure the team is all on the same page, to make sure that you get the services you need. So hopefully your doctor would do the referral, but if not, don't hesitate to advocate, and us low vision specialists will help you out too. It's definitely a team approach. But like I mentioned, in the beginning, I am an occupational therapist that has chosen to go further in my education to understand this realm of low vision. There are also optometrists and ophthalmologists that do the same thing. Typically, it's an optometrist that will do an extra residency or go further with their education to treat low vision conditions. So the model that I'm obviously most familiar with is within the medical model. So that would be a team of an optometrist and an occupational therapist. And what I mean by medical model is that we can bill insurance and we have a healthcare background. So the ideal situation would be that the patient would see a low vision optometrist. That optometrist would then recommend follow-up care with a low vision occupational therapist. The main difference, beyond, our education, is that we are looking at functional vision. And that is, how does your vision affect your day-to-day life? The optometrist would, do a thorough assessment and recommend equipment that might help maximize the vision. And then ideally, the occupational therapist can continue with that assessment of vision, because a lot of these conditions are progressive and we want to be, keeping up with what's going on. Then we can dive deeper into the goals, we can provide training on the equipment that the optometrist has recommended. And then, go further with lighting, appliance use, things that happen in the home, safety, technology, and organization has been a big piece for a lot of my patients lately. Just simplifying their environment has helped them greatly. So again, like I said, my most familiar relationship is between a low vision optometrist and low vision occupational therapist. But there are lots of other team members out there that it can be important to know about, such as orientation and mobility specialists. They help and ensure safe travel, whether that's on your feet, on a public transit, using a white cane or sighted guide. They do all of that training for someone that's visually impaired. They're also certified vision rehab therapists, certified low vision therapists, and certified assistive technology specialists. And these professionals may not have a medical background, but they've all dedicated their time to, learning how to assist people with low vision adapt. And they can't bill insurance. So a lot of times you'll find these services provided through state and federal programs or just private pay programming. So lots of good people out there that want to help. And there is, some overlap obviously amongst the professionals. So it's, okay to see us all, to get all of our ideas so that you can do the best that you can day to day. The exam is going to vary a little bit depending on the professional. But again, we're looking at functional vision. How does the vision affect that person's day-to-day life? They're going to use special charts that can actually get a little bit more of a detailed acuity, and that's the number 20 over 20, 20 over 30. We have some different calibrated charts that help us in low vision. We're also the optometrist is going to do a different refraction. It's going to be a trial frame refraction. So typically when you go to your optometrist, they put a phoropter in front of you, which is the machine that they put in front of your face that they can switch lenses and test whether you have a glasses prescription. A low vision optometrist is going to put the old time frame on your face, and they are going to manually take lenses in and out. The reason why they do that is they can make bigger jumps as far as the prescription, and also the person being assessed has a larger area to work with. So they can, if you have central losses or peripheral losses, that trial frame gives you a better chance to use your side vision, turn your eyes if that's what allows you to be successful. So they do kind of a more thorough refraction based on a person having low vision. And then they're also going to look at things like contrast sensitivity. That's your ability to see something on a background. They may also screen or test your visual field. That's your side vision. And then they're going to be interested in your goals. What are the things that you need to achieve or that you're frustrated with because of your vision, and introduce different equipment that might help maximize that or might help with the goal. Now, typically dilation doesn't happen because when an eye doctor dilates, it takes away your focusing system. So then we can't really look at reading and magnification. And so it's always important to have your general eye exam. For someone that has low vision, they need to have that general eye exam for the health and treatment of their condition. And the low vision specialist or optometrist is an addition. And then typically for a low vision optometrist, they're going to recommend you follow up if you have a vision change. You follow up if you have a goal change or a new frustration, or maybe on a year or two basis. So it's not something you have to do every year necessarily. And then, like I said earlier, it's ideal then that the low vision optometrist refer to myself, and in a kind of initial exam with me, I'm going to test some of those same visual things. I'm also going to test reading, because looking at letters is different than looking at words and sentences. I'm going to look for that kind of sweet spot, sweet size that they need. I'm going to train on some of the equipment that might have been recommended. And then we're going to dive deeper into more goals that, maybe occur at home. And one of the big things that find really important about the OT experience is the ability to go to somebody's home, see their lighting situation, see their safety situation, see what kind of organization might help them or decluttering might help them, and see how they perform with the equipment in their own space versus in the exam room. So all those things can be important, and I've had the privilege to go to many people's homes and provide service, and I think that's really the best way to provide my service. And insurance and Medicare typically gives the occupational therapist, I can ask for a certain number of visits, or I get a certain number of time to achieve those goals. So we can have multiple sessions, which is nice and helpful. The professionals available, in the Louisville area and throughout Kentucky are limited. So there are a couple of part-time optometrists in Louisville that have low vision experience. Same, in the Cincinnati area, there's the Cincinnati Association for the Blind. And then, there is a resource in the Lexington area and in the Pikeville area as far as professionals. There's someone that comes to, Southern Indiana that will also work with folks out of the Louisville and Kentucky area. But sometimes it's tough to find professional. But the VA also has low vision services. They have a comprehensive team. So if you are a veteran, that is a good service and a good way to tap into getting low vision.
Well, thank you so much for being on with us today to talk about your experience with low vision work and the patients who are in need of your services. So I will turn it over to Lindy to kind of let her talk about the creation of a new low vision clinic in Louisville and just kind of how the idea got started and where we are in that process. So thanks, Lindy, for coming on, and we'll turn it over to you.
Absolutely. Thanks, Jennifer. Both Jennifers. So we are very excited. The Kentucky Lions Eye Foundation just recently been working for months, but just recently had approval from our board of trustees to proceed with being the operating and managing arm, if you will, of the low vision clinic. So it'll be an extension of our programs and services that we provide to those in need of those vision services in support of our mission. And so this conversation has kind of gone off and on for several years now. Obviously, the COVID-19 pandemic made things a little challenging. I know, I think it was back in the summer of 2019, both Jennifer's and myself and Karen Hayes from our team sat down and we talked about the need and we wanted to explore it. And then, just various things have happened, but very excited that, fast forward to today and, it's more real than ever. Like I mentioned, we have approval to move forward and we have some supportive collaborative partners. And so I think that's, part of our mission is, through those collaborative partnerships to, enable the greater independence, increased quality of life. So those all perfectly align with a low vision clinic and making possible the access to the resources that are needed by these folks that Jennifer Gendeman talked about. And so, one of the biggest partnerships and key parts of this low vision clinic and making it, come to be very close to reality now. She mentioned the McDowell Center, but the Kentucky Office for Vocational Rehab and the Charles McDowell Center, they have generously stepped on board to provide in-kind physical space for the clinic to operate from within the McDowell Center. So very accessible. Also, we've had, kind of a committee that's been talking about this project, and Jennifer Gendeman has been a huge instrumental player in formulating a business plan, especially with her extensive knowledge and passion for low vision community. It's going to be a collaborative effort beyond even what I've already mentioned, some of our team players, and I look forward to seeing who steps up on board. So appreciate everyone listening and your, in advance for any resources or assistance or ideas that you can provide. But thanks again for your attention.